All right, hello and welcome to today's presentation titled 8 Things You Must Know About Medicare. Medicare is one of the things I get a ton of questions about, so I put this together so that you can have a good base knowledge on what you need to do when it comes time to apply for Medicare. So make sure you grab a pen and some paper and get ready to take some notes because there's a lot of good stuff in here, okay? So heading into retirement years, is going to bring a ton of new topics that you have to deal with, and one of the most frustrating, maybe Medicare. There's a lot of different things you need to know about it. So figuring out when to enroll, what to enroll in, and what coverage will be best for you can be daunting and simply overwhelming. So to help you wade easily into the waters, here are 8 essential things you need to know about Medicare. So the first one is Medicare comes with a cost. Medicare is divided into parts. So Part A, which pays for hospital services, is free if either you or your spouse paid Medicare payroll taxes for at least 10 years. People who are not eligible for Part A can pay a monthly premium, but it can be several $100s. Part B covers doctor visits and outpatient services, and it comes with a monthly price tag for most people. In 2017, that monthly cost is about $109 per month. And new enrollees will pay about $134. And in Part D, which covers prescription drug costs, also have the monthly charge, and that varies depending on the plan you choose, but the average Part D is a premium of $34 per month. In addition to premium costs, you'll also be subject to co-payments, deductibles, and other out-of-pocket costs. Number 2, you can fill the gap. So beneficiaries of traditional Medicare will likely want to sign up for a Medigap supplemental insurance plan offered by private insurance companies to help cover deductibles, co-payments, and other gaps. You can switch Medigap plans at any time, but you could be charged more or denied coverage based on your health if you choose or change plans more than 6 months after you first signed up for Part B. Medigap policies are identified by letters A through N. Each policy that goes by the same letter must offer the same basic benefits, and usually the only difference between the same letter policies is the cost, okay? So if you get a lower cost, it should offer the same benefits, so look for the lowest cost that you can. Plan F is the most popular policy because of its comprehensive coverage. A 65-year-old man could pay from $1,067 to $6,772 in 2017 for Plan F, depending on the insurer, according to the Weiss ratings. Number 3, there is an all-in-one option. You can choose to sign up for traditional Medicare, Parts A, B, and D, and a supplemental Medigap policy. Or you can go the alternative route by signing up for Medicare Advantage, which provides medical and prescription drug coverage through private insurance companies. Also called Medicare Part C, Medicare Advantage has a monthly cost in addition to the Part B premium that varies depending on which plan you choose. With Medicare Advantage, you don't need to sign up for Part D or buy a Medigap policy. Like traditional Medicare, you'll also be subject to co-payments, deductibles, and other out-of-pocket costs, although the total costs tend to be lower than for traditional Medicare. In many cases, Advantage policies charge lower premiums but have higher cost sharing. Your choice of providers may be more limited with Medicare Advantage than with traditional Medicare, so that's something to take into consideration. Number 4, high-income earners pay more. That's just how it is. If you choose traditional Medicare and your income is above a certain threshold, you will pay more for Parts B and D. Premiums for both parts can come with a surcharge when your adjusted gross income plus tax-exempt interest is more than $85,000 if you're single or $170,000 if married, filing jointly. In 2017, high earners pay $187.50 to $428.60 per month for Part B, depending on their income level, and they also pay extra for Part D coverage from $1,330 to $7,620 on top of their regular premiums. When to sign up, you are eligible for Medicare when you turn 65. If you're already taking Social Security benefits, you'll be automatically enrolled in Parts A and Parts B. You can choose to turn down Part B since it has a monthly cost. If you keep it, the cost will be deducted from Social Security if you already have claimed benefits. For those who have not started Social Security, you will have to sign yourself up for Parts A and B. So when to sign up? The 7-month initial enrollment period begins 3 months before the month you turn 65 and ends 3 months after your birthday month. So think about that. 3 months before the month you turn 65 and ends 3 months after. So you essentially have a 7-month window, 3 months before and 3 months after, and to add to that, the month you turn 65, okay? To ensure coverage starts by the time you turn 65, sign up in the first 3 months. That's really important. If you're still working and have health insurance through your employer, or if you're covered by your working spouse's employer coverage, you may be able to delay signing up for Medicare. But you will need to follow the rules and must sign up for Medicare within 8 months of losing your employer's coverage to avoid significant penalties when you do eventually enroll. So there is a quartet of enrollment periods. So there's several enrollment periods in addition to the 7-month initial enrollment period. If you miss signing up for Part B during the initial enrollment period and you aren't working or aren't covered by your spouse's employer coverage, you can sign up for Part B during the general enrollment period that runs from January 1st to March 31st, and coverage will begin on July 31st. Will begin on July 1st. But you have to pay a 10% penalty for life for each 12-month period you delay in signing up for Part B. Those who are covered by a current employer's plan, though, can sign up later without penalty during a special enrollment period which lasts for 8 months after you lose that employer coverage, regardless of whether you have retiree health benefits or COBRA. If you miss your special enrollment period, you'll need to wait till the general enrollment period begins. You'll need to wait till the general enrollment period to sign up. Open enrollment, which runs from October 15th to December 7th every year, allows you to change Part D plans or Medicare Advantage plans for the following year if you choose to do so. People can now change Medicare Advantage plans outside of open enrollment if they switch into a plan given a 5-star quality rating by the government. Number 7, costs in the donut hole shrinking. So what does that mean? One cost for Medicare is decreasing. The dreaded Part D, or also known as the donut hole, that is the period during which you must pay out of pocket for your drugs. For 2017, the coverage gap begins when a beneficiary's total drug costs reach $3,700. While in the donut hole, you'll receive a 60% discount on brand name drugs and a 49% federal subsidy for generic drugs in 2017. Catastrophic coverage, with the government picking up most costs, begins when a patient's out-of-pocket costs reach $49.50. And number 8, you get more free preventative services. So Medicare beneficiaries can receive a number of free preventative services. You get a free annual wellness visit to develop or update a personalized prevention plan. Beneficiaries also get free cardiovascular screening every 5 years, annual mammograms, annual flu shots, and screenings for cervical, prostate, and colorectal cancers. So I hope you enjoyed those 8 tips. If you have further questions or feedback for me, I'd love to hear from you. If you're ready to get planning for your retirement, you can go here to number 1 and sign up for a free 45-minute breakthrough session at www.kisplanning.com/apply. When you go there, you'll get a choice to pick out an appointment time that works for you, and also a short questionnaire that will help us maximize our time together. Highly recommend you do that if you're watching this video, if you haven't done it yet. You can also email me, jason@kisplanning.com, or you can go to kisplanning.com to get access to our most recent retirement webinar and also more free resources. So whatever you choose, I would love to hear from you. I'd love for you to leave a comment below. Let me know what you think, and also let me know what other things you would like more information on, okay? Once again, my name is Jason Hamilton. I'm the CEO of Keep It Simple Financial Planning, and I look forward to talking with you soon. Have a great day.